Could untreated sleep apnea be silently damaging your memory every single night? Snoring is not the real danger. The real danger may be what repeated oxygen drops are doing to your brain. If you ignore CPAP, you may not just feel tired. You may be putting your brain to high risk. What if brain fog, poor memory, and slow thinking are starting in your sleep? Sleep apnea is not only a breathing disorder, it can become a brain stress disorder. Hello everyone, I'm Dr. PK, and yesterday I saw a patient. And this is the second time I'm seeing her. She's a 75-year-old female. And she had severe decline in her cognitive function. All the workup has been negative so far. But she told me this is startling story that she was diagnosed with sleep apnea about 20 years ago. And she chose not to use it because she thought it's not that important, she can manage it. And she didn't like the idea of having something sitting on her face. So I do think strongly that her decline in cognitive function is because of untreated sleep apnea. So hence this video for you. We're going to talk about something very important, often ignored. A lot of people think that sleep apnea is mainly about snoring, poor sleep, feeling tired in the morning. And many people also think CPAP is optional. They say, I don't like the mask. It's uncomfortable. I can't manage without it. I'm still functioning. But there is a deeper question. What happens to the brain when obstructive sleep apnea is left untreated night after night, month after month, year after year? Can ignoring CPAP contribute to brain fog, poor concentration, memory problems, and even long-term cognitive decline? The answer is yes, it can. And today, I want to explain the connection in a very simple way, but also a deep way, so you can understand and what is happening inside the body and the brain. And please save this video, pass it on to somebody you love, you care about. What is sleep apnea? Obstructive sleep apnea, OSA, happens when upper airway repeatedly collapses during sleep. So while you are asleep, air stops moving properly. This means oxygen level drop, carbon dioxide may rise, brain senses danger, body triggers a partial awakening, breathing starts, then the cycle repeats again and again. For some people, this may happen dozens or even hundreds of times in one night. OSA is linked to repeated airway collapse, intermittent drops in oxygen, and repeated sleep arousals that disrupt normal sleep structure. So even if the person thinks they slept 7 to 8 hours, the brain may have had a very poor quality night. And that's where the damage begins. When the brain suffers, the connection between untreated sleep apnea and cognitive decline is not caused by one single thing. It's usually a combination of several injuries happening together. Intermittent hypoxia, sleep fragmentation, sympathetic stress activation, oxidative stress, neuroinflammation, vascular injury, impaired clearance of toxic brain proteins. And these mechanisms are the major pathways repeatedly described in reviews of obstructive sleep apnea cognitive dysfunction. So let's go through one by one. Intermittent hypoxia, repeated oxygen drops. It's one of the biggest problems. Untreated sleep apnea, oxygen does not stay steady at night. Instead, the brain is exposed to repeated episodes of hypoxia. Then breathing resumes, oxygen rises and then drops again. This is repeated hypoxia reoxygenation cycle. This repeated hypoxia and reoxygenation cycle creates stress inside the body and brain, and it is strongly linked to oxidative stress, vascular changes, and injuries to area involved in memory and cognition. Think of it like this. Your brain likes stable oxygen. It does not like being stressed over and over. The hippocampus, which helps form new memories, appears especially vulnerable, and OSA has been associated with hippocampal volume loss in broader brain health reviews. So when oxygen keeps dropping, the parts of the brain responsible for learning and memory may not function normally. This can show up forgetfulness, trouble focusing, difficulty learning new information, and slower mental processing. Number two, sleep fragmentation. The brain never gets fully restorative sleep. The second major issue is sleep fragmentation. In person with the sleep apnea, I may not remember waking up, but the brain is being partially aroused again and again. That means sleep becomes broken. When sleep becomes broken, the brain loses some of the most restorative stage of the sleep, especially deep sleep and normal sleep continuously. OSA related microarousals alter normal sleep architecture, including slow wave and REM related patterns, both of which are important for memory consolidation and brain recovery. Why does that matter? Because healthy sleep is when brain does important work, files memories, strengthens learning, restores attention, resets stress circuits, supports emotional regulation. So if you keep waking up even briefly, your brain cannot do its normal overnight repair work. That is why many people with untreated sleep apnea feel mentally dull, foggy, less sharp, easily distracted, exhausted even after sleeping. Number three, sympathetic overactivation. The body keeps going into alarm mode. Every apnea episode is like a mini emergency. The body reacts by activating the sympathetic nervous system, the fight or flight system that causes stress hormone release, blood pressure surges, heart rate changes, vasoconstriction, and increased cardiovascular strain. OSA is associated with repeated sympathetic activation and vascular stress, and American Heart Association has highlighted sleep disorder as important contributors to brain health through these pathways. Now imagine this happening not once in a while but many times every night. That means the brain and blood vessels are spending the night under stress instead of recovering. And these chronic responses can affect attention, mood, executive function, and long-term vascular health. Oxidative stress, repeated wear and tear. When oxygen drops, then rises, it creates oxidative stress. Oxidative stress means body is producing damaging molecules that can injure cells, blood vessels, and neurons. This kind of mechanism has been repeatedly described in chronic intermittent hypoxia models like OSA. This is important because brain is highly sensitive to oxidative injury. So over time, untreated sleep apnea can create a kind of chronic biological wear and tear. Not dramatic all at once, but slow, cumulative, and harmful. Neuroinflammation, the brain becomes inflamed. Low oxygen and broken sleep do not just make the brain tired, they make it inflamed. Inflammation in the brain can interfere with the normal neuronal functioning, memory circuit, synaptic plasticity, emotional regulation, brain resilience with aging. Blood vessels damage and vascular cognitive injury. Untreated sleep apnea strongly connected with high blood pressure, insulin resistance, atrial fibrillation, stroke risk, endothelial dysfunction, and cerebral small vessels injury. In 2024, American Heart Association scientific statement on sleep and brain health emphasizes that OSA is linked with increased risk of mild cognitive impairment, dementia, Alzheimer's disease, and that vascular as well as neurodegenerative mechanisms are likely involved. So vascular cognitive impairment, that means the small vessel of the brain are getting damaged over time. Possible link to Alzheimer's because of protein buildup, because of hypoxemia, neuroinflammation, disrupted sleep architecture, and beta amyloid and tau accumulation. You'll start having brain fog, poor concentration, trouble multitasking, forgetting names, and reduced mental sharpness. So thank you for watching. Save this video. It will be useful. Share with somebody you love.